their own funds, which is equivalent to 2.5 million. And across this period, we have attained the additional use of family planning of about 1.3 million. And so this is how the model works, and the councils. We have four state government express or present to us the model. When we market our model, wherever the council is interested with our model, they bring to us expression of interest, and we start from there. We work together and designs including the TCI University. I think you will find that sometimes everyone to see the TCI University and how it works. And then the council has to implement, and they are ready to commit. After that, we go to the third stage. But in between the third stage, we have a contract that we enter. The council will commit some fund to support this implementation. And then from the program design, we come up with fixed amount award, which is a contract that will be funding some activities as a catalyst fund, which will stimulate the system to work better. And after those contracts, we enter into third stage, which is implementation, where there is a huge implementation of high impact intervention, which has been proven to lead into the impact. And this goes about 3 years. And after that, we start the pre-graduation sessions, when across our implementation, actually from the beginning, we implement with the concept of begin with end in mind. So from the beginning, we know that at one point we will end. So at the end of stage 4, across all these stages, and we have set self-efficient, and we have set a bar at that when we say this council is reaching maturity and it's ready to graduate. When the council is graduate, the challenge fund stop. What remaining just to us, and we can provide is that if one of these 4s is missing in this interlocking tenet, the rest will not work up. So the first one is scaling up. Our aim is and make sure that we push. And the other tenet is efficiency. One is sustainability. And in the sustainability planning, to ensure that in the plan, it's leading into the impact. So this is just an example. And I will make a proven tool map together with them, and they are used on updating every here and then. And the member of the TNMC CPD point during their accredit is the TCI University. And if you complete them, you'll find point. And high-performing platform that can then ensure that there is a continuity of begin with end in mind. So our impact fund will stop, and they have to continue with put the local government at the drive the seat. And I'll hand over this mic.
Thank you. Let's give him a big round of applause. Are we facing the being explained well? So I would like with a degree from the Open University of Tanzania, Mbeya City, Secretary in Tabora. Let's give him a big round of applause as she approaches the stages. Our next speaker is Laura Chua. Laura is a public health specialist with a degree in nursing and extensive research experience, currently serving as the reproductive and child health coordinator of Arusha City Council. Previously worked as a zonal health. The third one is Andrew Method. Dr. Andrew Method is a public health specialist with a degree from the Hebrew University and Muhimbili University. Currently, the regional medical officer of Manyara. He has researched adult and sexual reproductive health, focusing on menstrual hygiene management. His experience includes roles as a medical officer for Dodoma and district medical officer for Sia. Welcome, Dr. Andrew Method. Our last speaker is Salum Ali Manyata. Dr. Salum Ali Manyata is a medical doctor specialized in public health, currently serves as Assistant Director for One Health at the Prime Minister's Office, with over 20 years experience in regional and local government roles. He previously worked as a regional and district medical officer. Now he leads multi-sectoral collaboration on the health and non-communicable disease, and he drives the implementation of the National Action for Health Security. Welcome, Dr. Salim on board. Group session, whereby
are not as a in the beginning, during the planning of family services, within the facility where the cost improved even the other medical, but the recent and young and youth, sexually reproductive facilities to make sure
usual mode sure observed in Tanzania Health Summit and Youth
serve as a reproductive and child health coordinator for 2019.
Health Summit and Youth
Serve as a reproductive and child health coordinator for 2019 up to 2009. Later on, we'll see how the TCI University up to 2009. Later on, we'll see how the TCI University to reproduct also. And also we have is from the DHI. So the certificate of the traditional also of community TI from municipal and all TI from municipal and all land and all output as is and all output as is it will. I can
Miss Laura, let's give a big
it will. I can
Miss Laura, let's give a big you call high. You call highs means high impact. So we give you, that's why she talked about from TCI.
It's a lot of so what we are discussing about working into the authorities, the facility they plan, but also with the facility government is what are their priority they plan, but also with the facility government is what are their priority to those activities and and that's when team and they understood what future years are supposed to allocate collections, able to set aside funds from the family planning activity. 88 million. So after that to the program. So 88 million. So after that to the program. So basically, sustainability starts with the program. The program is still there. Full is still there. Full platform of TCI attended. They're keeping being a platform of TCI attended. They're keeping being implemented in the facilities. Form of TCI attended. They're keeping being implemented in the facilities, which we implement in the facilities, which we facilitate. Look, the local challenge plan, which we facilitate. Look. The local challenge planning and they are doing poor is very good.
Oh, thank you so much from location.
Very good.
Oh, thank you so much from location. For permitted is not an port family planning and a
allocated
port family planning and a
allocated first of all do a process for the in this study activities and in relation of for the in this study activities and for the in this study activities and in relation implemented activities. Find the use of implemented activities. Find the use of these activities. Find the use of these. All of them could add for this. All of them could advocate provide as if advocate provide as even the expenditure of this kind of financial system that in the DH of this kind of financial system that in the DHS planning activities. Family plan they have to family plan they have to execute the planning activity so that to ensure as we planned.
Yes, this venue. We have them. Yes, this venue. We have them over there. So after the question sessions, each one of us will have a moment to go about there, ask millions of questions. Sustainability of family. Go about there, ask millions of questions. Sustainability of family.
We all must see action of maternal mortality. It's all the important thing is to maternal mortality. The important thing is to integrate the CTC, and that's the first thing. Maternal and child health, and that's the first thing. Maternal and child health, percentage for the family planning to continue with the family planning to continue with the services in our health to continue with the services in our health We all understand the services in our health facility. We all understand that involvement of the. We all understand that involvement of the. We need to understand that involvement of the. We need to and other stakeholders. We need to and other stakeholders to training. And other stakeholders to training. Improve the importance as to training. Improve the importance services for the youth. Improve the importance services for the youth tenant.
To him,
services for the youth tenant.
to him, TCI contributed
Youth tenant.
to him. TCI contributed this improve the allocation of resources. TCI contributed this improve the allocation of resources. This improve the allocation of resources.
The data for decision making.
Resources.
The data for decision making. We were used it to meetings. The data for decision making. We were used it to meetings where one review meeting. Because the platform also formed to do the review meeting. Because the platform also formed to do the DQA through the DQA through the do as a government how we are going of as a government how we are going of the TCI meetings sexual reproductive health to allocate meetings sexual reproductive health to allocate resource for the number of or to decrease the number also the to do in the ground diversity as a skills good decision as we know and those other do and
Interventions. Interventions.
Wilton, it was able which was high impact yielding comparing which was high impact yielding comparing they mobilized when we plan a day for the enrich they mobilized when we plan a day for the enrich outreach. So I think for the told us in that outreach. So I think for the told us in that at the universities in Dodoma at night told us in that at the universities in Dodoma at the universities in Dodoma at night in Dodoma lady who just throw a baby at night in Dodoma lady who just throw a baby university and talk to that lady in the community because she precious she didn't receive the community because she precious she didn't receive any information. And you know what she was telling us? She told us, like, Doctor, look, it was my first time, and that's when I got pregnant. And that's a university student. It was very flexible during the dialogue is at university students, and is at university students, and provided a platform area. Provided a platform areas like if we take the site as a whole, where does like if we take the site as a whole. Where at even the border you'll never
Interventions. Comprehensive Council Health.
First approved interventions. The local interventions. The local each year at least by 10%. Or that each year at least by 10%. Or that facilitate then and also facilitate then and also quick and quick impact decision for this we own dialogue from unsafe abortion. Thus we have to adapt this kind of approach and put them into the CCHP. And also this high impact intervention as a platform there where from that platform option we encourages and improving.
So let's patch up as I do, okay? Then we go to our group.
And the moderator as well. Today, and then Arusha, I think, spoke about the positive that you have been encountering. But what spread to other intervention planning? What else, including mental health issues?
So Nanji goes over there. Okay.
Question to see how the LGA are fair learn post.
Yes, I total that there is a difference between the fund been mentioning that taking a reference from the show here. How much did you allocate and how much has been what are the key as the family?
Yes.
Family planning reduces much. So we know that Catholic based is almost a Catholic base of family planning.
Discussion
again especially when education for climbing up to you and education for climbing up to use TCI sustainability approach, but it's not replicated apart from implementing. Family planning services very much.
Thank you. Thank you.
He was our RMO Bagland. Services. When we go, we include the mental health, VD age, because as we know, the cervical cancer screening, and for the issue of we know screening, and for the issue of we know that the TCI project is phasing out. We know that the TCI project is phasing out, so we commit that the TCI project is phasing out, so we commit the RH when saying the enrich is this, we prepare to say the enrich is this, we prepare together. Question from commitment budget for 25 for budget of 95%. For budget of 95%. It's not so bad, but as we can. Yeah. They'll make it private. They'll make it private. Partner. It depends with somebody. We collaborate with institution, the government collaborates with our ward. We don't have the village where the TCI is planning. So the role of PPP sectors. Regarding how we, it's called decentralized health center, and that is it to get service.
Actually, it's what search them the modality. Sure, if we keep on using this model, them on radio, you don't find them they're in the social media. So, but then we really need still
to all the panel.
There was the buy-in is
rely how to platform for scale uploaded university. Unaona ile kama kuna mradi unataka, unaona ile kama kuna mradi unataka, tumeziweka ni offset kwa sababu ile kisha wande mama na so tu kutoka kwetu, lakini vingi kutoka kwetu kwa sababu then we come to deliver your program. It's a living thing. Every day we upload news. Shift ya university. English zinalipa kuliko hata mdau wa kuiza. Kwa situ na hema not cost effective. Hata mdau wa kuiza. Kwa situ na hema not cost effective. For high impact intervention itoe ile. Yapo kuna ile mama akija ile high impact attitude and practice. Printer una janabi just consumer, lakini kumbe just consumer, Lakini kumbe hii ya family cop ni kitu vizuri. We come
the outcome. Idadi ya watu.
People who were unreached. So pia kwa maswali machache then to close. Remarks, but the intro.
I know Ari and Hassan, and most importantly, all of the incredibly proud of, because it really is walk the talk from the writing these proposals and the panelists for all conference. So
Round of applause.
these proposals and the panelists for all conference. So
Round of applause.
I hope that as financing and services uptake and appropriate the services. We thank you all for
audience. I really